My name is Dick Mul. I'm a pediatric-endocrinologist and I work in Diabeter, both in patient care and in clinical research. We are a large clinical center and we have lots of data on patients, and the first line of research in Diabeter is better use these data from the patients in order to improve our daily care. The second line of research includes research in early complications. That's the Edddy project, all aimed at better identification of patients at risk or already having complications. It includes three sub-studies. The first sub-study in Edddy is on neuropathy. We need to have better tools to identify early damage in children and adolescents. And what we showed in the results we have so far is that we are indeed able to show early damage. The second one is research in Intima-media thickness in children and adolescents. We studied that and we had also a control group. And what we showed is that indeed after 6 years of treatment we see a thicker Intima-media thickness in patients compared to controls. Not in all patients, but in general. That shows that there is heterogeneity in patients. The one patient with good regulation does get deterioration of the Intima-media thickening, while the other, which is not so well regulated, does not get the complication. So that's also a new theme that we should further elaborate on. Why does the one get it and the other does not? The third project is on lipids. Of course, an important contributing factor to damage, vascular damage mainly. And what we try to show is, can we track the levels of lipids in these patients from diagnosis to later on? And does that help to identify the patients at risk for damage or not? The third line of research is on psychosocial problems in children and adolescents with diabetes. In that we include studies on depression in patients, on attachment, and on how parents do their jobs in diabetes management. The translation of the study results in daily clinical practice is of course an important aspect of our research as clinical care center, and that's something that we are studying now. How can we do that and make that a normal part of clinical care?